Okay, today we are going to do a tape job for Achilles tendonitis. And this is not a long-term solution to Achilles tendonitis. This is just something that you might do to help somebody through a practice while they're going to physio or going to a doctor or waiting for some anti-inflammatory medications to kick in. And you're just trying to keep them active. So what we're going to do is put a big fan on the back that when the athlete dorses into a full range of motion, this fan will tighten up and take some of the load off the Achilles tendon. It's not the most comfortable thing because it's an elastic fan and it tends to hike the heel up in the air when you're not bearing weight on the foot. But you can try it for the athlete. It might work. We're going to be putting anchors around the calf muscle, and because it's around the calf, we have to make sure that we allow for expansion of the contracting muscle, and therefore we always use elastic tape. And we're going to be doing another very similar tape job at the elbow for a hyperextension injury, and so it's important to learn some principles about taping with elastic tape. If I put these anchors on, the way we put the anchors on for the closed basket weave or the gibney, I would put one here, and my next one I would half overlap and put it down here. There's a problem with that. And there's a problem with having the ends where there's any tension down from either a fan or elastic tape or trainer's tape, because elastic tape has very, very little surface area on which to make contact with either the skin or for a tape on top of it to make contact. Because it's stretchy, when it's not stretched, it makes little folds like that. So the only area that's really available is the little curved area at the top of the waffle. And there's very, very little surface area and contact, so the bonding is very weak. So because of that, we have to put a lot on the skin. If we're going to be using elastic tape, we need to use a lot as an anchor because it just isn't very strong. The other thing is, and this is related because it doesn't even stick to itself really well. So if this athlete is running around and brushes her leg up against somebody, it falls apart. It comes apart really, really easily. Both the ends rolling up, and also if I were to put some tension down on here, these ends pull out, and you can see how that top edge was rolling down, and the end just pulled out on there. So there's really no structural strength there at all. So here's a couple of tips about putting elastic tape on. This tape job that we're doing is going to cross over the ankle joint. The elbow crosses the elbow joint. So when you're putting elastic anchors on the skin, put your first anchor down low, and we're going to work away. I'm also starting and stopping on the opposite side of where the fan is going to be. The fan is going to be on the back of her leg. So I'm going to start and stop on the front. And I'm working away from the joint. The ankle joint is down here. I'm putting each of my leg anchors, moving a half overlap away, and I'm starting and stopping on the opposite side. And when I work away, I can put as much tension down here as I want because the overlap is that way. I'm not going to roll it up. I mean, it would roll this way, but there's no tension on the tape up. So this is going to work nicely. I'm going to have all the tension down the back here where I don't have any starts and stops, and the overlap is correct. And I'll probably put one more on here. And I'm also going to need an anchor on the foot. And for the foot anchors, I can do exactly what I did for the closed basket weave. Just keep the anchors an inch back from the first and fifth metatarsal heads, splay the foot, and just lay the tape down. If you could get another anchor on here somehow, definitely go for it, because again, this tape, elastic tape, doesn't stick all that well. So what do we got lots of room over here actually. So I'm going to angle this a bit and bring that up there. So I'm still back far enough on each side. And once I get my leg anchors on, then I can make my fan. And I can make the fan out of elastic tape, which I'm going to do right now, and this is the one that you're responsible for in the taping exam, is the Achilles with an elastic fan. I can also make one with a trainer's tape fan, but that it would only be used after surgery, where I absolutely don't want any movement and tension on the sutures because they would tear out. The elastic, I want full range of motion. So very different. So I'll get you to line your stomach. That's good. So I'm going to put 3 fans on here. And it's okay to use scissors when you're using elastic tape. Some of you will have a bit of trouble tearing it. So I'm just going to start one piece on the anchor right in the middle of her arch and bring this up fairly snug, and then take a pulled length off the top of her anchors, tear the tape off, and split it down the middle. And I'm going to get the bottom of my tear here so that it's just up on the anchoring material. And I can go a bit lower because I just want to plantar flex her foot. Just relax your ankle. I don't want to plantar flex it all the way. I just want to get some plantar flexion on it, so a little bit more, and then wrap these up and around the leg, like that. So there's one. You see how thin this is when it gets stretched out. You can see my finger through it. The V this time, whoop, I rolled it. It's going to be just a little bit lower than the last one. And I've got a considerable, is that a pen or a pencil?
No.
Anybody got a pen? So I'm moving the bottom of the split down a little, and the third one will be down here. I'm moving them down, and so that these tails are overlapped, almost completely overlapped, because again, the binding is so poor. I want to get as much surface area and contact as possible. If I put these one on top of the other, they would just pull off with a very small amount of tension. So I'm going to put the third one a little bit lateral. So I got one dead in the middle, one that's over here on the medial side of the arch, and one that's a bit on the lateral side of the arch. But basically they all come over the same spot on the heel. A little bit of tension, and again, wrap those around. And once I get this fan on here, I can get her to flip back over and I can finish my tape job off. So the first thing that I'm going to do is finish this part off. And then if I have to make any adjustments, I can make the adjustments on the foot. So now I'm going to anchor off on top. And when I do this, I'm putting them in the opposite direction. You have to do the mental gymnastics and look at what's going on the underside of the tape, and it will have exactly the same overlap so that it doesn't roll up under tension. So again, I'm going to start and stop on the front, not putting any tension. Try and keep your tear lines where you tear this off in a nice straight line if it's possible. It doesn't have to be perfect, but you want it to be close. So when you're putting elastic anchors on the skin, you work away from the joint. When you're putting your anchors on top, you work toward the joint. And that way you'll have as strong a base as possible. But we still have these ends. And even though I smoosh this down, if she hits anybody, it's going to start coming unraveled. And pretty soon this thing is just going to roll up. So I'm going to get these ends right down, and then I'm going to use a short piece of trainer's tape on these ends of the elastic tape, maybe 2 inches on either side of the ends, so it's not going all the way around. I'm just going to do this and do a half overlap with each one. Top to bottom. And once I get them on, now I'm going to really squish this trainer's tape onto the elastic tape, because I don't want this to come unraveled. So on the taping exam, when we come around and you say, okay, my tape job's ready, the first thing that we'll do here is rub our hands on the ends of this tape and make sure that it can't roll up, because if it rolls up, it's not going to be functional in 5 minutes. Okay, so you've got to get that to stick down. The next thing we would do is try and tear this out. So I'd roll her over and pull on this thing as hard as I possibly can. If it pulls out of the tape job, it's no good. It's not going to hold. So right now I haven't finished the tape job off. I haven't got my anchors on the skin. So I want to make sure that I've got this tape under the right amount of tension. So I'm going to take her good foot, her uninjured foot, and see how much dorsiflexion she's got. She's got quite a bit in here. So I'm going to take this one. You can hear it tearing.
Yeah.
Yeah. So she could really feel a lot of pull on that, because to get this into full dorsiflexion, this is tight as a bowstring back here. You can actually feel it starting to tear. It's a little bit too tight. So if it's a bit too tight, then I would just take this off. I'll take this off. And then dorsiflex the foot, pull it tight again, put it back on, and then try it again. And now I can get full dorsiflexion while this is nice and tight. So I would just adjust that, and if you have way too much here, you can snip it off with the scissors or whatever. But now I'm ready to put my foot anchors back on, and again, put these on top. Remember to splay the foot. I just want to make sure that this is comfortable for her, especially at the back here, where the stickum on the tapes tends to grab the skin. So I'm just going to take a heel and lace pad, and I'm going to put this, slide it up so it's not on the skin. and just smoosh it onto there and tear those off, and we have a nice clean looking thing that's not going to stick onto her foot. It's a little bit at the bottom, that's okay, I want that to be tight. Now if she goes out and runs around and then she comes back and says, actually this is really, it's gotten too loose, I can tighten this up by using some trainer's tape. Because I'm below the calf flare, I can use trainer's tape. So I'm just going to put a few of these on exactly the same way that you would put them on closing down for the basket weave tape job. And I'll just put 2 on here and try and dorsiflex her foot, and I actually can't quite get it into full dorsiflexion anymore. So just putting a couple of straps down here will really tighten this tape job up, and I could put another one on here if I wanted and really tighten it up. So you can adjust it after they've been out running around and got it warmed up and a bit stretched. So this is the Achilles tape job with a fan that you will be expected to know for the exam. And I'll just show you a variation, the post-surgical thing, and again, I doubt that you're ever going to be asked to do this tape job, because typically the physio or the occupational therapist would be responsible for that. We're trying to keep these pieces of elastic tape up here, so if you want to use them and practice on your partner, you can use these ones as long as they stand up. But it's really important that at some point either you and your partner share the cost of one roll of elastic tape and take it off carefully like this and stick it on the edge of the table. But you really need to practice to make sure that you get the direction right, and that you're not starting and stopping on the same side as the fan, that you look after all of these issues about elastic tape that I mentioned, because it's really easy to lose marks. The trainer's tape fan is really huge at one, really wide at one end and not very wide at the other end. Because this binding is so poor, when I make a fan out of trainer's tape, I have to make it so that it fits halfway around the limb. So when we're talking about the elbow, the top of the trainer's tape should go halfway around the limb, halfway around the lower limb. And that way you probably have enough anchoring material to hold it. When somebody pulls on the arm into full extension, it's not just going to tear out. And you don't need to ask, how much should I put on for the exam? You can't put enough on. That's the simple answer. If I put elastic tape up to the top of her calf, and I would think that's beautiful. If you put that much on in the exam, had a huge big anchor here, that's fantastic, because the chances of it pulling out when I come and yank on it are negligible. You do smaller than this for some unknown reason, it's going to pull out, I guarantee you. So I'm going to again take a quick measurement of what I need for her, and then I'm going to build a fan on the table, and it's going to be this wide at one end, and it's going to have to be wide enough to go all the way around there. So it's probably going to have to be about 10 inches wide at the other end. So I overlap just a little bit down here, very little overlap at that end, and almost a full piece overlap at the other end. And just go back and forth. And this isn't a real deal, so I don't have to bother making this thing as wide as it should be. I'll just give you the main idea. Put some strips, fill it in. Want this really strong so it doesn't stretch. And at the end, I've got one that's just as wide as her foot down here, and this should wrap around her leg pretty nicely. So I'll get you to roll over again. And this is going to be, just slide this way, perfect. So I just stick that on there, and then I would find the spot where it's going to tighten up. So if she says it's getting tight right there, then I would put as much tension on that as I can and wrap that around her leg, roll the edges, make it nice and strong. And once I get my fan on, just check, make sure, I would tape this off completely, just the way I did with the last one. Put my elastic anchors down, put some trainer's tape on the ends of it so it doesn't unravel, and then I would flip her over and I would check the length here again. If it wasn't quite tight enough, then I would take this off, plantar flex the foot a bit, put this back on, and check it. And then once it gets so that she doesn't feel any tension on here, I've got a good length, and then I could button it up. So if it's finished off the same as the other one, but the difference is I want to limit dorsiflexion so that there's no tension in here at all, so it doesn't pull the sutures out. So there's another option for you. I'll take these off, save them for someone. So that's it. Next week we have a tape job for subluxing patellas, or people that have problems with patellar subluxations, dislocations, even subpatellar pain syndrome in an athlete. A couple of variations on that. And then we move to the upper body. There are tape jobs for the knee. There are tape jobs for medial collateral sprains, and the tape, you put anchors all over here and run the tape crisscross over the medial joint line, and somehow that's supposed to. They don't work. This lever is too long. If somebody hits you here, the force times this moment arm is greater than the tape can withstand. So actually taping somebody's injured knee is like putting a bullseye on their leg and telling everybody else that my knee is injured, come and hit me and I'll be out of the game. So you don't tape knees. If people have problems with rotational instability, there are specific braces that they can get, derotation braces, and those are fine. Most people after ACL injuries get those derotation braces. So there can be issues around the knee that are dealt with, but tape is just not strong enough. Football players, put hinged braces on their knees to stop their medial collaterals getting injured, and actually the steel bends before the ligaments tear. I mean, the ligaments are really, really strong. The tape is hopelessly weak compared to a steel bar, and they still don't help. So there we go. So that's the tape job for today. Thank you. Thank you.